This is TLC-To-Go.
Welcome to the Deep Dive. Today we're unpacking some, I think, really valuable insights, this specifically for health sciences faculty.
Okay.
And they come from the UTHSC Teaching and Learning Center, the TLC.
The TLC, good resource.
Yeah, if you're not familiar, they're basically this great hub, right? Supporting educators, helping enhance learning. They have all sorts of programs, resources. I think they have things called 5-Minute University.
I've seen those. And the Teaching Excellence Institute.
Right. So it's all about giving you practical tools, helping you teach well, which means, your students learn well.
Makes sense.
So our specific focus today, the core subject, is writing effective multiple-choice questions, MCQs.
MCQs, the bread and butter of assessment for many.
Totally. And let's be honest, we've all seen those questions, right? The ones where you're scratching your head.
Oh, yeah.
Not because you don't know the material, but the question itself is just so twisted.
Convoluted, yeah. You can't figure out what they're even asking.
Exactly. It's frustrating and kind of disheartening, really, when an assessment feels more like a weird puzzle than a check on your knowledge.
That's a feeling I think many students and probably faculty writing them can relate to. It really hits on a core truth, though.
Which is?
Well, that while MCQs are, everywhere in health sciences education and super important, their simplicity is deceptive. There's a real complexity to doing them well.
So why are they so popular, then, if they're tricky?
It really comes down to efficiency. They're great for assessing a broad range of content fairly quickly. They're relatively easy to score.
Especially with computers.
Exactly. Perfect for computer-based testing. But the critical part, like you hinted at, is that when they're well constructed, MCQs can go way beyond just remembering facts.
Okay, how so?
They can actually test a student's ability to apply knowledge, to analyze information, even demonstrate some pretty sophisticated clinical reasoning.
Clinical reasoning from a multiple choice. Interesting.
Yeah, and just so we're all on the same page, when we say MCQ, we mean the question part, that's the stem, and then the set of answer choices. One is the right answer, the others are the wrong ones, the distractors.
Got it. STEM, correct answer, distractors. Okay, so if good MCQs can test higher order thinking, like clinical reasoning, let's flip that. What happens when they miss the mark? What are the actual dangers of badly written questions, besides just, annoying students?
It's a really significant issue, actually. Poorly written MCQs can be quite detrimental.
How so?
Well, they can flat out mislead students. They can encourage something called cueing.
Cueing, like giving hints.
Sort of. It's when students guess based on subtle, unintentional clues in the question or the answers themselves, not based on what they actually know. Or, like you said, they might test something completely irrelevant, not linked to the learning objectives at all.
Testing the wrong thing.
Right. And the research in medical education is really clear on this. For MCQs to work, they have to align with learning objectives, they need to reflect the right level of cognitive complexity, and they must avoid flaws that mess with their validity or reliability.
Validity and reliability, making sure they measure what they're supposed to measure consistently.
Precisely.
Yeah.
And developing those high-quality questions, it takes real care. Attention to the content and the structure. Plus thinking about things like reducing bias, making sure they're fair for all learners.
So for you listening, you health sciences faculty, this is, it's more than just tweaking wording, isn't it?
Oh, absolutely.
It sounds like the quality of your assessment questions directly impacts how accurately you're gauging what your students know. And, I guess, how well you're preparing them.
That's exactly it. If our assessments aren't accurately measuring critical skills, clinical reasoning, diagnostic analysis, we risk graduating professionals whose understanding isn't as solid as it needs to be for patient care.
Wow. Okay, so the quality of MCQs can actually ripple out into patient safety and efficacy. That's a heavy thought.
It underscores the importance, definitely.
Okay, so given that impact, let's talk benefits. What are the concrete advantages of actually putting in the time and effort to write really good MCQs?
There are three main benefits that really stand out in the research and practice.
Okay, number one.
First, they significantly improve student performance and the quality of the assessment itself. It's pretty straightforward. MCQs that follow good item writing rules lead to a more accurate picture of what students know. And often, that means stronger performance overall.
And bad ones do the opposite.
Exactly. Poorly written items can artificially lower scores or raise them and basically just obscure what students have genuinely learned. There's research Payton Caldwell back in 2014 showing this direct link. Good items, better performance, both for the student and the item itself statistically.
Okay, makes sense. Benefit number 2.
Second, and this is so key for health sciences, well-designed MCQs actively promote clinical reasoning and decision-making.
Right, moving beyond just facts.
Yes, this is where you craft questions that make students apply principles, interpret clinical data that might be complex, analyze patient scenarios. You're testing how they think, not just what they remember.
Can you give an example?
Well, think about the distractors, the wrong answers. If they represent common errors in reasoning or plausible alternative diagnoses, the student has to actively weigh the evidence presented in the STEM. Tarrant, Ware, and Mohammed showed back in 2009 how effective distractors really push students into higher-order thinking. It simulates real clinical challenges in a way.
Gotcha, so the wrong answers are just as important as the right one, in a sense.
In crafting a high-level question, absolutely. And the third benefit, they greatly improve the validity and reliability of your assessment.
Back to validity and reliability.
Yes, because when you have clear stems, really plausible distractors, and everything is tightly aligned with your learning goals, the question is much more likely to accurately measure competence.
And less likely to measure random stuff.
Pretty much. It reduces what's called construct-irrelevant variance. Fancy term for measuring things you didn't intend to measure, like test wiseness or reading speed, instead of the actual knowledge or skill. Foundational work by Haladina, Downing, and Rodriguez really lays out these guidelines for solid assessment.
Okay, this is great. We understand the why good MCQs matter so much.
Yeah.
Now, I'm really eager for the how, the practical tips. What can our listeners, these health sciences faculty, actually do to make their MCQs better? This is where it gets really interesting, the application.
Absolutely. Let's get into the nuts and bolts. We've got several key tips. First, and maybe the most fundamental, align your questions with your learning outcomes.
Seems obvious, but maybe harder in practice.
It can be. You really need to use frameworks like Bloom's taxonomy or maybe competencies specific to your discipline to make sure you're targeting the right cognitive level. Are you testing recall, application, analysis?
So don't just test random trivia, unless remembering that trivia is the learning outcome.
Exactly. Don't default to testing trivial facts unless that foundational knowledge is explicitly what you're aiming for with that question.
Okay, align with outcomes. What's next?
Next, write clear, focused question stems. The stem needs to present a single, clearly defined problem or question.
Keep it simple, stupid. KISS principle.
Kind of, yeah. Avoid cluttering it with unnecessary background info, and definitely don't try to teach new information within the question itself. That's confusing.
And ambiguity.
Avoid ambiguous phrasing like the plague. It just confuses students rather than actually challenging their understanding of the material. Clear and focused.
Clear stems. Got it. What about the answers?
Right. Use plausible answer choices. This is huge. All your choices the right one, and the distractors should look similar. Similar length, similar level of detail, similar grammatical structure.
Why is that so important?
Because the distractors need to be tempting. They should represent common misunderstandings, typical errors in reasoning, or maybe other relevant clinical options that are incorrect in this specific case. They need to be plausible to someone who doesn't fully grasp the concept.
Okay, plausible distractors. What about those old chestnuts? All of the above, or none of the above?
Yes. The advice is generally avoid them. Strongly avoid them, unless you have a really specific, compelling pedagogical reason.
Why the hate for all of the above?
Think about it. If a student knows just two of the options are correct, they can often logically deduce that all of the above must be the answer, even if they're unsure about the third option.
So it makes it too easy sometimes. Reduces the cognitive load.
Exactly. It can turn a potentially complex question into basically a 50-50 guess, or easier, it short-circuits the deeper thinking you might want.
Okay, avoid those unless you have a very good reason. What else?
You also need to actively avoid common item writing flaws.
Such as?
Things like subtle grammatical clues. Maybe the stem is plural, but only one answer choice is plural. Students pick up on that. Or patterns, like the correct answer is always B or C.
Right, mixing it up.
Definitely mix it up. Also, negative phrasing. Questions like, which of the following is not? Try to avoid them if you can, because they can be confusing. If you absolutely must use a negative, make it stand out. Bold it, capitalize it, something.
Okay, highlight negatives if used. Any other flaws?
Be really careful with absolute terms. Words like Always, never, sometimes, occasionally.
Why is that?
Well, always and never are rarely true in medicine or science, so savvy students might dismiss those options immediately, making the question easier than intended. Sometimes and occasionally can be too vague. I have to admit, early in my career, I probably used those absolute terms more than I should have.
A common trap.
I think so. You think you're being precise, but it can backfire and not really test the core understanding.
Okay, avoid flaws like clues, negatives, absolutes. What else makes a good MCQ?
A really powerful technique, though it requires a bit more effort, is to pilot test and analyze your items.
Run them by some students first.
Ideally, yes, or at least analyze the data after you use them. Look at item analysis statistics, things like the difficulty index, basically, what percentage of students got it right,
Okay.
and the discrimination index. This tells you if your high-performing students are getting the question right more often than the lower-performing students.
So does the question actually separate those who know the material from those who don't?
Exactly. This data is invaluable for seeing how your questions are actually performing and figuring out how to improve them over time. Iterative improvement based on evidence.
Makes sense. Any tips specifically for the health sciences context?
Yes, definitely. Include clinical context when appropriate instead of just asking a dry factual question.
Like what drug treats X?
Right. Instead, use a brief clinical vignette, a short patient case. Then ask a question based on that scenario. Based on this presentation, what's the most likely diagnosis, or what's the best next step in management?
So it simulates real-world decision-making.
Precisely. It promotes that transfer of learning, gets students practicing diagnostic reasoning. That's what we ultimately want, right?
Absolutely. Okay, one last tip.
Yes, and it's about fairness. Design for all learners. Be mindful of your language. Avoid idioms, slang, or overly complex sentence structures that aren't related to the actual content. Avoid cultural references that might not be universally understood.
So language barriers or cultural differences shouldn't get in the way of showing content knowledge.
Correct. Think about universal design principles when you're creating assessments. Make them accessible and fair for everyone.
Those are fantastic, really practical guidelines. It strikes me, listening to this, how much thought needs to go into those distractors, the wrong answers.
They're crucial. Plausible, related to common errors, but clearly incorrect.
And avoiding those little unintentional clues, the grammatical giveaways or the absolute words, it seems like small things can have a big impact if you're not careful.
They really can. It's about precision in assessment.
So wrapping this up, what's the big picture takeaway for you, the health sciences faculty member listening? It feels like mastering this art of MCQ writing. It's not just about making grading easier.
Not at all.
It's really about fostering deeper learning, ensuring your assessments are accurate, and ultimately contributing to the competence of our future health professionals. That link to patient safety and effective care really resonates.
Exactly. It's fundamental to good education in our field.
Any final thought for our listeners to chew on? Something provocative.
Maybe just the idea that assessment isn't a one-way street. It's a continuous cycle of learning and refinement. For the students, obviously, but just as much for us, the educators.
We learn from how our questions perform.
We should, yes. That commitment to quality assessment, constantly trying to improve it, it's really a core part of our professional responsibility. It drives better teaching, better learning, and ultimately better patient outcomes down the line. It's an ongoing journey for all of us.
A powerful thought. Assessment is a learning tool for educators, too. Now, if people want to dig even deeper, this deep dive doesn't have to be the end of the road, right?
No, absolutely not. The UTHSC Teaching and Learning Center, where this original material came from, has more great stuff.
Like what?
Well, there's a Writing Effective Test Questions series mentioned, which comes from UC Davis's Center for Educational Effectiveness. Sounds very useful.
Okay.
There's also a specific webinar, Writing Effective Multiple Choice Questions by Hall and Scott from 2023, hosted by the UTHSC TLC itself.
The webinar could be great.
And for faculty at UTHSC, there's a really in-depth resource, the Item Writing Guide from the NBME, the National Board of Medical Examiners. That one usually requires UTHSC access, but it's a gold standard guide.
Fantastic. Lots of avenues for further exploration. Well, we really hope this deep dive has given you some valuable insights and, more importantly, some practical tools you can use to elevate your teaching and assessment.
Hope it was helpful.
Thank you so much for joining us today on the Deep Dive. We look forward to having you back with us next time as we explore another fascinating topic.